Was on task 1. I think. Dr. Anu is there? Dr. Anu? Is there Dr. Anu? No.
I can do task 3, ma'am.
Yeah. No, we have not completed task 1 actually. Dr. Anu is not there. So Dr. Muthulakshmi is there. Muthulakshmi, would you like to do?
Yes, ma'am.
Okay, quickly, huh? We
Yes,
have to
ma'am.
rush.
Next page, ma'am. Any other page, ma'am? First page, ma'am.
Start.
Hi, I'm Dr. Muthulakshmi, one of the doctors in the obstetric clinics today. How may I call you?
Yeah, you can call me Alice.
May I confirm your age, please?
34.
So, Alice, I can gather from your GP letter, this is your second pregnancy, and we are here to discuss about your delivery plan. Am I right?
Yes.
Alice, so since we are meeting for the first time, shall I ask few more questions to know more about you better? Then we'll plan a suitable management for you.
Okay.
So, could you please tell more about the current pregnancy?
Doctor, this is my planned pregnancy. I'm 28 weeks into my pregnancy. And so far as everything is normal, my baby is kicking good. All blood group, tests are normal. Everything is normal.
So, have you named your baby?
No.
So, any recent scan for the baby has been done?
No, doctor. At 20 weeks, my scan was done. Everything was normal.
So, otherwise, any concerns in this pregnancy, like pain, pain in the tummy,
No.
and or sugar test was done in this pregnancy?
Yeah, I'm due for that.
Okay. So, I can gather from your notes that during your first pregnancy, you had more bleeding after the delivery. Could you please tell more about the first pregnancy?
Doctor, actually, it was a very troublesome pregnancy. When I got pregnant, although it was a planned pregnancy, I had
Mm.
this severe nausea, vomiting. I was admitted for 2, 3 days. And after that, I had started this diabetes also, which was controlled pretty much on the diet. And I really went into quick labor at 40 weeks. Baby was also not that big, it was just 3.5 kg. But after the delivery, I don't know what happened. I started pouring very badly, very heavily, and it was not stopping. They tried calling people, there were chaos, they were calling people, there were people running, shouting. They start me on certain medications, certain drips, but it was not stopping. They transfused me 4 pints of blood also, and at the end, they took me to the theater, and then they put some balloon inside, kept me under observation for a prolonged time, and after that only I got relieved. But yeah, after the procedure, it was very frightening experience. Me and John was totally frightened, and I do not want similar situation to do happen with me this time also.
So at least your concerns are valid. So it must have been a difficult time at that moment. And this time we'll make all the necessary precautions to make this journey very well. So
Okay.
have you been connected to counselors? And how was the recovery after that?
Recovery was little difficult, doctor, as I lost much of the blood, so I took like little time. But yeah, okay.
So any support groups was offered that time?
Yeah, I was in touch. I had counseling sessions also, but it was good.
So how is John doing now?
John is my husband's name. My
So,
baby is, yeah, baby is doing fine.
so any medical concerns like in that pregnancy, like
No,
low blood counts,
no,
any high blood pressure?
no. It was a smooth pregnancy. Only diabetes was there.
So any allergic to medications are you having?
Yeah, I'm allergic to certain medication. I don't
So,
remember the name
so,
exactly.
so shall I check your notes, last delivery notes with your permission to know more
Yeah,
about it?
yeah, you can.
So any family
Penicillin.
history
I'm
of,
penicillin, allergic to penicillin.
okay, I'll note it down. And any family history of clots.
No,
So aware of your height weight ratio
it's normal.
and blood group.
It's positive.
So you're not having any
Positive.
reservations to transfusion, right?
I already received 4 transfusion, doctor.
Um, Otherwise, how is your support at home
Yeah, me and my husband are very happy couple.
and what do you do for your living?
I'm a school teacher.
So,
Oh, sorry,
uh,
I'm a home care assistant. I work for this elderly home care.
right, okay. So, Alice, during that time, someone explained what is the cause for that bleeding after the delivery.
They said though they couldn't able to identify why this bleeding. Sometimes there might not be any reason. But I just wanted to know whether there is any chance and what will be the treatment, whether I have to go through this
Yeah.
similarly, and can't to do cesarean section for that.
And your afterbirth was delivered normally, or they took
Yeah,
some maneuvers
no,
to.
they didn't get delivered.
So now coming to your this pregnancy care, so we'll also arrange sugar test for you and also scan for the baby's well-being now. Okay, am I
Okay.
clear? Okay. So and also so our further care will be in a consultant-led care unit with a team of doctors like my consultant, blood doctor, baby doctor, okay, and also special nurse and also an anesthetist doctor. So, we'll be offering your routine visits in the consultant-led care unit. So, and your delivery also will be planned in a consultant-led care unit. So, what we'll do is as soon as you admitted, so we'll put our IV cannula through your arm and we'll check your blood counts and we'll reserve adequate blood and blood products during labor. Am I clear?
Okay.
So, and also we'll give a pain relief with the help of anesthetist, and also this time, so we'll give prophylactically some medicines during delivery, which controls the bleeding.
Okay.
So generally, this bleeding we call this as a postpartum hemorrhage. So it
Hmm.
could be because of the the tone. That means the womb is not able to contract because of either big baby or the water level is high, or there may be a prolonged labor, and sometimes there could be an retained beds, and very rarely it may be any bleeding disorders. So are
Okay.
you having any history of any family history of bleeding disorders in your
No, no,
family?
no, no.
So the most common cause will be the womb will not contract after delivery. So,
Okay.
so this condition can recur in this pregnancy, but will take almost all the precautions to reduce the complications as much as possible to make your journey as easy as possible.
My God, doctor, I'm really scared of all those situations. Okay.
So any concerns you're having till now?
Now, if at all it happens, how you are going to manage?
So, yeah, so we'll usually, this time prophylactically, we'll reserve all the blood products and keep. So, immediately we'll give blood and also we'll give medicines to contract the womb. And if any excess bleeding, we note it down immediately, we'll shift to theater and put the balloon before complication arises.
Okay. So, doctor, do you think that this cesarean section can minimize and can give means can I have a cesarean section to prevent this complication?
Yes, so concerns are valid, but I'm sorry to say again, the mode of delivery will not reduce this bleeding complications.
Okay. I'm really thinking means that I should have a cesarean section so that this may not happen again.
So again, cesarean section will not reduce this bleeding complication. In fact, it gives added more complications of surgery and anesthesia.
Okay, okay. Okay, doctor. And then
And
okay.
also, yeah,
Okay, then I
yes.
will go for vaginal birth only then if it is so.
Yes, so yes, your plan, I mean, when to deliver will be decided by the team of doctors by 36 weeks of gestation by checking your sugars and the baby's growth and also assessing the neck of the womb, how far it is softened. Okay.
Okay.
And
Hmm.
post delivery also will monitor you continuously and will give support, give analgesics, will support you in breastfeeding, and also will discuss about the suitable contraceptive options that time.
Yeah, doctor, thank you.
So I'll give a detailed patient information leaflet, and I'll book an appointment with the consultant. Also connect to the counselors and support groups. Document your care in your notes.
Thank you, doctor. Okay. Your own reflection, easy task comparatively?
Yes, ma'am. Easy, but not prepared well.
No, it's okay. Only
Yes,
two,
ma'am.
three
Yeah,
questions.
task is easy only, ma'am. So not.
Okay. Not much to say here.
Yes, ma'am.
You having a ability of going into too much of depth. Okay. When the
Yes,
role player
ma'am.
said that my current pregnancy is normal, normal, normal,
Okay.
please take it normal.
Okay, ma'am. Okay,
Now.
fine. Mm.
Okay. Everything is normal. Yes, everything is normal. So that means two, three
Okay,
times
need
I
not.
said,
Okay, ma'am.
that you take it that this is
Okay.
planned pregnancy, my blood
Yeah, ma'am.
booking blood
I
test,
understood on that.
hemoglobin. But
Yeah.
again you asked me two questions.
Mm.
Okay, past history you elicited good. Family history of bleeding disorder is important, not any other history.
Mm.
Clot history is not important here. Okay. Jehovah Witness, yeah, you need to ask, but you can see that she has already been received
Yes,
four
ma'am.
points. Okay, so that is
Like we
situational
can
awareness.
acknowledge and say, ma'am, we do
Yeah,
not have any
yeah.
reservation on
So
that.
I am aware that you, so
Uh,
you will accept, you can modify your questions. So I am
yes,
aware
ma'am.
that you received previously blood. So in case of emergency, will you accept it again? Okay. in case of emergency, will you accept it again? So that is one question which you can reframe it. Then mostly, okay, analgesic was a medical
Jargon.
jargon.
Yeah.
Yeah. So here introduction, midwife call to see patient referred by GP, consultation, discuss mode of delivery post PPH or heavy bleeding post delivery. Concerns, you means I was having multiple concerns, so you addressed most of them. Let the patient explain. So what, acknowledge the difficulty and say some reassuring words. Yes, means if I said you asked me regarding my current pregnancy, if asked about the previous experience, so yeah, I had a very terrible time and all those things I said, na, say some reassuring words or something like that. Yes, few women experience this kind of problem like post delivery bleeding, and it might be a terrible experience for many people, means those who are experiencing it. So how was treated, okay, blood transfusion, surgery, any surgery, baby, how is the baby, okay. So all those questions for the regarding the previous year, current pregnancy, whether it is planned, unplanned, booking blood test, hemoglobin, iron supplementation. So this important point is iron supplementation. If you are not on any iron supplementation, we can keep start your iron supplementation so that your hemoglobin will be higher side. uh, then the rest of the acknowledge her bad experience, and although PPH is associated with risk factor, there are measures to minimize it. But many a times we come across this condition as an emergency, and if not treated, can lead to life threatening. But they were in her care, the best part was they were able to take care of that situation and handled it in the with the best possible care, with the best possible outcome. Okay, so did they debrief you? Okay, this is very important question. Did they debrief you? Did they come up with the counseling post delivery? So, yes, after 6 weeks, the consultant saw me and they debriefed me about the situation. And yes, I was in touch with the counselor for some time. Here, mental history, do still you, because it is, see, it is something which is very, it was that frightening experience which was there in my mind. So, whether it is still there. Okay, so do you have the flashbacks or something like that? Okay, vulnerability, emotional concerns. So if it is so, would you like to talk about you? Here you can offer that counselor if she is still getting the same. Medical, surgical, you acknowledge smoking, alcohol. Access case details for better known USG for placental position. This is the only thing which you had accessed. Okay. So what you knew from your case detail that you had a heavy bleeding after birth. That means a bleeding more than 500 ml post delivery is labeled as heavy bleeding after birth. In our medical terminology, we will call it as a postpartum hemorrhage or PPH. Okay, so this is PPH, and in your case, it was a primary PPH because it has occurred within first 24 hours. Previous PPH has happened, there wasn't any risk factor in her previous case. Okay, no, previous in previous case PPH there wasn't any risk factor like big baby, uh, prolonged labor, operative vaginal delivery, cesarean section, abnormal position of the baby placenta. In her case, it was abnormal position of the placenta in the initial gestation, but it has went up. Okay, so it was not a placenta previa at term. So any medical disorder, so no risk factor was there. And yes, without a risk factor, the placenta miss PPH can do occur. Hmm? So it is very important to identify the risk factor, and if that risk factor is there, then we need to book these cases under consultant led care unit to prevent the recurrence and treat it accordingly. So previous PPH is risk factor for PPH. Now, since in her case the risk factor is her previous PPH, so that is an important risk factor for her to have a postpartum hemorrhage in this pregnancy, and that's the reason she will be booked under a consultant led care unit, and she will be monitored, observed for bleeding after delivery. Here the blood and blood transfusion facilities need to be available, one important point. And if possible, if it was very heavy torrential, then this cell salvage intervention radiologists, those are the alternatives which also can be discussed. Most of the time the simple measures will able to control this kind of bleeding. Now the causes of bleeding, you mentioned most of the points, but you can mention in 4Ts format. So tissue thrombin tone trauma, so you can mention in that thing also. The one more question, what are my chances of having the PPH? So there I very nicely I got very nice this UK midwife association's guideline, okay, screenshot. So the previous PPH, 4 out of 100 women can have another PPH, and without previous PPH, 2 out of 100 women. So the chances of she getting PPH is double now. That means 4 out of 100 can get compared to 2 out of 100 who had not had previous PPH. So these are your chances. Risk factor you had been explained. Measures. So now I wanted to know about measures in detail, because here nothing is there. Nothing. You do not need to explain me. So you mentioned about we will discuss a mode of delivery by 36 weeks. No, you can wait for spontaneous labor to occur. You will go in labor. You will deliver normally because there isn't any concerns regarding your labor. So you can say that we will wait till we will wait. We can very easily wait till 41 weeks. Once you went into the labor, you will be monitored in the consultant led care unit, where we will be putting IV line. We will be keeping blood and blood products handy, and inform the blood bank also. Monitored, once the baby placenta will be delivered, active management of third stage of labor will be offered to you, and then we will keep a watch on your bleeding. If most of the time there may not be any heavy bleeding, but if at all there will be any heavy bleeding, then we are having measures to tackle it immediately. Something like we will be taking care of you in a team manner. There might be people coming up, okay, for help, for having extra help. We will start you on extra medications. So these medications are in various forms. It will be in either into the drip, either through the tablet form, or through the uh, injections into the muscles. Okay, so these are the medications which we have to elaborate these things more. Okay, so this will be started to you, and most of the time we may have to repeat these medications for means after some time. These medications will most of the time act wonderfully, and the womb will be contracting. The first another thing is, we will try to assess the cause of bleeding. If it is a tissue tone, then the medications will work wonderfully, and if it is a tissue which has been damaged, then in that case we have to see, and we may have to consider another option like tranexamic acid also. But if it is a tone because of which the bleeding was there, then medications work wonderfully. If not work, in that case we may have to take you to the theater, and for that we will be getting reviewed you from the anesthetist. We will be putting a balloon under anesthesia, under all aseptic precautions in the theater, and we will see to you it that you get responded. But yes, sometime in few of the situation, these measures may not work, and in few cases I don't want to frighten you, I don't want to give it to you a very means I don't want to frighten you, but in few cases we have come across with a situation where we have to deal with opening the tummy, going ahead with taking some brace sutures around the uterus, uh, ligating some blood vessels supplying the uterus, and at a time, if at all the bleeding is very heavy, not getting control, then going ahead with a difficult decision of removal of the womb, that is known as hysterectomy, with the consultation of two consultant. Okay, so you have to say all these points. Hmm? So do not stop there. Then that cesarean section, yes, you had mentioned, you had addressed very nicely. Seniors blood bank will be involved. Any situation will be under, if the situation will be under control in most of the time. Occasionally, we do require removal of the womb. That is a surgery in the best interest to save the life. Cesarean section will not prevent this type of injury. On the other side, it's a risk factor for PPH. And along with that, cesarean section will having its own pros and complications like injury, bleeding, infection, anesthesia risk. So all those are the risks associated with cesarean section. However, in her case, the vaginal delivery chances are very high because she's delivering for the second time. So very good chances that she will deliver vaginally. And PPH risk are more common in both the options. If it has to happen, it has to happen with both the ways. Okay. So currently we will assess your hemoglobin, even her sugars. Okay. I had mentioned here, arrange blood sugars. Sugars here only we can say. Ultrasonography for baby's growth, iron supplementation will be offered to you, and we will try to see to it that your hemoglobin will be kept high. So shall we document her care, inform the consultant patient information regarding heavy bleeding after birth, can offer counselor if these feelings are still bothering you, follow up with consultant and arrange blood investigations. Okay. If it happens, it do happen, then we will be informing the risk management team. Okay. So very nice attempt, I will say, but nothing is there. So explain about the PPH management in more. They expect you that from this station. Okay.
Okay,
Detailed
ma'am.
history of previous experience, review of notes, a certain concern, fear, recurrence, traumatic experience, review ultrasonography. So nothing is there in the information gathering. Introduce concerns of the patient, address them, discuss recurrence, plans to minimize the recurrence, possible reasons for PPH, precautions to be taken, explain risk versus benefits of vaginal birth and cesarean section. PPH guideline. Okay. Patient safety, confirm patient details at the start, ensure emotional support for the patient, seem to have traumatic experience. Any evidence that psychological support was offered. Okay. Empathy, empower patient to make an informed choice. Options of cesarean available but does not avoid PPH. We'll have to have blood group and save IV line, active management of third stage of labor, and build up hemoglobin. These are the patient safety point. Okay. Any question anybody is having? Simple task, very easily you can handle. Okay.